NBC2 News Today.
Welcome back. This morning we are joined by Dr. Cederquist, who has some interesting statistics for those who use complementary and alternative medicine. Dr. Cederquist practices preventative medicine and weight management in Naples. How are you doing this morning?
Fine, thank you.
I hear you recently took part in a study and there's some interesting results.
Yeah, this study was actually done by AARP, and what it did is it surveyed 1,600 adults age 50 and above. And what they found is that 63% of them reported using some kind of complementary or alternative medicine. What was more interesting to me, is that 69% of those said they had never discussed it with their regular primary doctor.
Now, for people that may not know, can you give us some examples of this kinds of medicine?
Well, on this particular survey, what they said is that 45% of them used some kind of body treatment like massage or chiropractic, what most people don't necessarily consider alternative treatment, but 42% were referring directly to using dietary supplements or herbal supplements.
Now, did the adults surveyed in this not speak to their doctors about this? What was the case?
Yes, they had different reasons for doing so. What they found is that 42% said that their doctor never asked them. 30% said they didn't realize that it was something they should bring up with their doctor. 19% said there wasn't enough time in the medical visit, and 12% said they were specifically concerned that their doctor would be angry that they had used alternative medicine, so they didn't tell them specifically.
Now, is this a growing trend? I'm actually very interested in this because you have these statistics memorized. Why aren't all doctors on board with it?
Well, the thing is, as a doctor, what concerns me about this survey is that we know that people use complementary and alternative medicine, and many doctors are not upset about it, and they actually use it as part of their treatments. But for an individual patient, knowing that information is important. A very good example that we use in the medical community is the herb ginkgo biloba. This herb is actually a blood thinner, and it may be safe for many people, but if someone is taking a prescription blood thinner like Coumadin or the antiplatelet drug Plavix, that person may be at risk for intense bleeding because of the drug interaction and herb interaction. And the dietary supplements are not going to say anything about that. The information or the warning is going to come from a patient's own physician. What I think is very smart, and I love when patients come to see me and do this, is to actually have a typewritten list of all their medications with dosages and all supplements with dosages. And I saw a patient this week who also listed all of her doctors with their phone numbers, and that is great because a lot of people are seeing multiple doctors, they are taking different supplements, and avoiding drug interactions and drug supplement interactions is something that can be done as long as doctors are kept in the loop and we know what's going on.
So basically, your doctor may not recommend it, may not even bring it up or broach the subject, but if you are going to start on these treatments, it's great to interact with your doctor, hear his opinions.
Absolutely.
All right. Good information. Thank you very much for waking up and being here with us today, and we will be right back.
1-866-401-3438 or go to www.bistromd.com.